Muddy River News. Our home, our news.
I think vaccines become such a personal choice this time of year when you're talking about the fall season vaccines. Our biggest goal is to protect the most vulnerable populations, which is going to be our senior population and those young babies. So that's why the new RSV vaccines came out in the last couple of years, for both infants, pregnant women, and that older adult population. There's RSV vaccines because that's one of those infections that can be really severe, and it's a lower respiratory tract infection. So those came out. Those have been working really wonderfully. And the whole goal of respiratory vaccination is to keep people from getting really, really sick. I think there's a lot of misinformation that vaccines keep you from getting all of these infections at all. But the goal of vaccination is to make sure that we're not in the hospital, on the ventilator, in the ER, doing all of those trips that we want people not to be in the hospital with these infections in the fall.
Are we seeing activity already?
Not anything with flu yet. I think we have not seen we have not heard or seen any flu positives yet. But yes, COVID is out and about, and pneumonia, and all. We're back to school, and as soon as we get to that back to school time frame, we know that children love to spread lots of fun illnesses to one another, and we start seeing an increase in COVID, in RSV. Para-influenza, all of that starts in the fall, and that's where we're at.
But nothing unusual.
No, this is normal activity.
So what is the call to action from this point?
Absolutely. So influenza vaccine season is here. That you've probably seen lots of places offering flu vaccines. We're one of them. We have been a huge flu vaccinator in this region for many, many years. This weekend, normally we always do the John Wood Community Drive. We have the drive-through out there at John Wood. We're actually changing it. The big reason why is the construction out there on 48th and State. So we are actually going to do our drive-through clinic here on campus because we got really good at doing drive-through testing and everything else through the COVID. So we're going to take what we did out at John Wood and bring it here on campus. And that is going to be Monday, the 29th, from 5 to 7 p.m.
So what should people know? What do they have to bring with them? What is the process?
So we would really encourage you to pre-reg. You can go to our Facebook page to get that pre-registration link, or you can call us here at the health department and we can get that pre-registration for you. So you don't have to stop at all. You just drive through and we'll get you right to the nurses to get your vaccinations and right out the parking lot.
And is there a cost?
So most insurances cover preventative vaccinations, and that includes flu, COVID, pneumococcal, and the RSV vaccines. We've seen the majority of insurances cover them. So we are not asking for money at the time of service unless you want to pay cash for those. Regular dose influenza vaccine is $40, but most of the time we bill it to insurance and there's no out-of-pocket fee.
What about the uninsured who are like, I don't think I can get any vaccines?
Absolutely. So we also have a program. It's called the 317 Adult Vaccine Program and the Vaccines for Children program that actually covers the cost of influenza vaccines for children under the age of 19 and then all adults 19 and older as well.
So what are the qualifications, though? Because some people may be transitioning between jobs. Mm-hmm. Is there an income requirement in order to qualify?
It is uninsured, or you have insurance that does not cover vaccinations. So those are the two qualifications for those two programs.
And how do you sign up?
You just come down here to the health department and we'll get you taken care of.
Anything I neglected to ask you that you feel is important to get across?
I think there's... What I really want to talk about with flu vaccination is that there are a ton of studies that have been looked at every single year. For the flu vaccine has been around for a very, very long time. It is one of the most trusted vaccines as well. And we have seen a decrease in uptake in the influenza vaccine over the last 5 years. It saves lives, especially when we're talking about that older adult population and those young children. It's so critical to be able to help protect yourself so you can protect them as well. So we also know that there's studies out there now that say that adults have a higher increased risk of heart attacks and strokes from having the influenza virus in their body. So those are those are not new studies. Those studies have been out for a while, sharing that information as well. So we just want to make sure that if you want the vaccine, we want it for you. We've got it here. Please think about it. So Adams County will be out and about in the community, not in just Adams County, but also in Pike County for the next several months, trying to get through about 35 total flu vaccine clinics, including our drive-through that we're doing next Monday night. But some of those are private, but we have 6 here in Adams County that are public flu vaccine clinics, and we have 3 in Pike County that will be public flu clinics. So be watching Facebook pages, Facebook posts for all those dates and times. Again, if you pre-register, you can call us or use the QR code on the link on Facebook to pre-register, and we'll walk you right through. You don't have to stop and do any paperwork at all. So we've got an incredibly smart group of nurses and providers that are well-versed in all of the vaccines, all of the benefits, the risks, all of the side effects. They can talk you through everything, every question that you have about all of the flu, pneumonia, COVID, RSV vaccines in the fall for respiratory protection. So if you have any questions, just call us here at the health department, and my nurses would be happy to talk to you as well.
Muddy River News. Our home, our news.